Hi, my name is Joe Moore. I'm one of the nurse practice students. This is our neuro exam, week number 6. All right, so I'm going to enter the room. Knock, knock, knock. My name is Joe. I'm the nurse practitioner student. I'm here to do your exam today. I saw that you filled out your paperwork out front. Let me get my picture. Filled out your paperwork out front, and you've confirmed that we can do the exam today. What is your name?
Lisa.
Is that correct? You give us authorization to do the exam?
Yes, I did.
All right, so when she was walking in, one of the first things that I noticed was how her gait was. I'll get to that in just a little bit when we describe the cerebellum and the gait. But for right now, I'm going to do alert and oriented. All right, and so alert and oriented, let's give me your full name.
Lisa Moore.
Date of birth.
5/17/67.
What address are we at right now?
19594 Highway 14.
All right, who's the president?
Biden.
Biden, all right. And what would you do if you were inside a burning house?
I would get out.
All right, so she's alert and oriented. She's got the right ideology. She's coordinated in her thoughts. Her speech pattern is fine. It's appropriate. The cadence and all that we're looking for, everything is fine. So she doesn't have any problems like that. First thing we're going to do is go to our cranial nerves. Cranial nerve 1, olfactory. We'll have coffee or some smell in here. We're going to have her close her eyes. We're going to occlude one nostril. We're going to go to the other nostril and see if she can identify the smell. We're going to do it on the other side, one side at a time. Then we're going to go to the Snellen chart, cranial nerve 2. Use the Snellen chart. It's either in a pocket. We obviously don't have one here, but a pocket chart from 6 feet, wall chart from 20 feet. And if there's anything inappropriate there, we're going to send her straight out to the appropriate ophthalmologist or optometrist, whatever she might need. All right. And so for cranial nerve 2 and 3, we're going to do the following. Look straight at my nose. We're going to do consensual and direct. Cranial nerve 2 and 3 are okay. Here you go. Watch the tip of this. And so is convergence. There's no nystagmus or anything. She's direct and consensual reflexes are intact bilaterally, all right? And so cranial nerve 3, 4, and 6. Let me summarize them. 6 takes the eyes laterally. 6 on the left goes lateral. 6 on the right takes the right eye lateral. 4 crosses our eyes over. The right side, as I'm looking at you, goes down and in. The left side goes down and in, cross-eyed. Everything else is cranial nerve 3. It's just that simple. And so we're going to do that. Cardinal signs of gaze, follow the tip of my finger. Do not move your head, please. Thank you. All right. We're going to do a little bit of peripheral because I just always do peripheral. Tell me when you can see this.
No.
Tell me when you can see this. I'm going to have to turn my back to you to do this properly, both sides at one time.
No.
All right.
No. 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 No.
All right. And so peripheral vision is intact. I'm sorry about that. It's not exactly the best setting. And so anyway, that was our 3, 4, and 6 cardinal signs of gaze. Ocular movements, excuse me. All right, so for 5, we're just going to check a little sensory right across here, the 3 portions of it, above, below, and along the jaw. Just like that. Just use a little cotton ball, close your eyes. Tell me if you can feel this.
Yeah. Yep. Yeah. 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 Yeah.
All right, so she has light touch sensory. Open your jaw. Move your jaw right to left. Okay, good. All right, so she's got a little motor going on, and it's fine. It's appropriate. Cranial nerve 6, we already discussed. 7. I want you can see me from here. I want you to look straight at the camera, wrinkle your forehead. I can see it clearly. I want you to puff your cheeks out. All right, and smile for me. There you go. 7's taken care of. 8. Close your eyes. Repeat after me.
Baseball.
All right.
Apple.
All right. So the whisper test is okay. I would use a different tuning fork, but this is the one that I have. Tell me if you can hear this on both sides or just one side.
Both.
All right. We're doing the Weber. We're going to move to the Rhine in a minute. Rhine does bone versus air conduction 2-to-1. Air should be longer than bone, and that's the way we're going to have. We like it that it lateralizes bilaterally for her. Tell me when you can stop feeling this on your mastoid process.
Okay, now.
Can you hear it?
Yes.
Okay. We're going to do that on both sides. Whoop. Tell me when you can stop feeling this.
Now.
Can you hear it?
Yes.
Okay. So Renee or Rhine test, that's all within normal limits also. All right. So cranial nerve 9 to 10. Open your mouth. We're going to take a look in here. We're going to do a gag reflex, which we're not going to do. Anyway, if she has a gag reflex, it doesn't lateralize or anything, it looks appropriate, then 9 and 10 are checked. All right, 11, shrug your shoulders up against me. Good. Turn your head against my resistance and against my resistance. All right, the SCMs and shoulder shrug show us 11. They're within normal limits also, 5/5, all right? And for 12, stick your tongue straight out. All right, put your tongue back in. If it lateralizes, it always lateralizes to the side that the mass or lesion or whatever is on, okay? So there's your cranial nerves. When we're done with those, we're gonna do her cerebellum. Let's do your gait. I want you to get up and I want you to walk over here. I want you to walk heel to toe, right over there. All right, turn around, walk back to me on your heels. Good, and walk back over there on your toes. Okay, very good, very good. Oh, come on back here. Stand right here and remain standing. Turn around and face me. All right. Put your arms out by your side, palms up. Close your eyes. All right, there's balance there. Romberg's test. I want you to open your eyes now. Bring your arms right in front of you. Can you see this? Yeah. All right, bring your arms right in front of you. Close your eyes again. All right, we have the appropriate response, so go ahead. There's no pronator drift or anything. Why don't you have a seat back down, please? All right, so there's no pronator drift. Romberg's is okay. We're going to move on. What I want you to do is take your hands like this and alternate it back and forth. All right, that movement is appropriate. It's not jerky, it's smooth, as it should be, all right? So we've already done our walks and everything. Right now, what we're going to move to is sensory. We're going to move to, close your eyes, put your palm out, your left palm. Tell me what you feel in your hand. You can reach down around it, feel it. What is it?
Paper clip.
All right. Put your right hand out. Tell me what you feel in your hand.
Cotton swab.
All right. All right. So the stereognosis is fine. All right. We're going to do a little 2-point discrimination. Then we're going to move to some vibration and all. I'm going to have to destroy my paper clip here. But 2-point discrimination up top, you're going to have to move these 2 points pretty far apart if you go down distally. The further away you get from the spinal cord, it's harder. So down below, we might have to use a little wider. But up here, keep your eyes closed, open your hands. Tell me if this is a single point or if it is 2 points.
1,
Okay?
1,
Okay?
1.
All right. Again?
2,
Okay?
2,
Oops, sorry. I let go of it. All right, my bad.
1.
All right. So we're going to do 3 spots up here. We're going to do 3 spots down below. Let me go ahead and relax your arms and everything. I'm going to do this down below again. So we're going to do it here.
1,
Okay. We're going to do it down here.
2,
Okay.
2,
All right. Tell me again. 1 or 2.
1,
All right. 1 or 2.
2,
1 or 2.
2,
Okay. And 1 or 2.
2.
All right. 2-point discrimination. is appropriate for her. Let me put this over here. We're going to go over here. I would use a different one. Tell me if you can feel this vibration.
Yeah.
Okay? Tell me if you can feel this.
Yep.
Can you feel that?
Yeah.
Can you feel that?
Yeah.
And we'll go to this side. We'll do the same thing.
Yes.
I haven't hit this pretty hard because it's a higher frequency and it's just harder.
Yes.
All right, one more time. Can you feel this?
Yes.
All right, her sensory to vibration is within normal limits. All right, let's do this. We're going to do some sharp or dull now, all right? Let me use that cotton swab. We'll just use something like this. All right, this would be dull. This will be sharp.
Okay.
Sharp or dull? Close your eyes.
So, dull. Sharp. Dull. Dull. Sharp. Sharp.
Okay. Those will be a little different. She's got pants on, but we would normally be in a hospital gown. You know, it is what it is. Sharp or dull?
Sharp.
Okay, relax your leg down.
Oh.
Okay, sharp or dull?
Dull. Sharp. Sharp.
Okay.
Dull. Sharp.
Okay. Sharp or dull? It's within normal limits and it's appropriate, all right? All right, one last thing. I want you to hold your hands out like this, palms down. Close your eyes for me. Tell me whether I'm moving your finger up or down.
Up. Down. Down. Up.
And we would go through this, and we're going to do this for the feet too. They can't see it. But anyway, it's going to be up or down.
Up. Down.
Okay. Relax your leg.
Up. Down.
And up or down. Just move the fingers up and down. Have her tell you what you're doing. All right. Now, let's do some of these. We got the cerebellum. We got the sensory done. Let's do a little strength, and then we're going to do some deep tendon reflexes, all right? We really only do a few of the muscles up here, but we're going to start off, palms down like this, fingers out, resist me. All right. We're going to check the strength of these muscles between the fingers. Go like this, resist me, flex your wrist, resist, okay, flex it in. All right, lift up, push, oh, wait a minute, palms up, push down against me. There's the bis, there's the tris. All right, relax your arms, push forward just like a bench press, straight out. All right, straight back. There's the anterior and the posterior delts, push straight out, and in, go down. There you go. Abductors, adductors, all of them are 5 over 5. We're going to do the same thing with the lowers, and then we're going to use the hips, the rotators, flexors, extensors, and we're done. All right, so I want you to lift up against me, push in, push out. I'm going to rotate. If we had a table, this one would be a little easier, but I would simply ask you to rotate your hip in, rotate in. Good, good. Take this, rotate in. Good, good, good. All right, push out against me, push out against me. Pull in with the hamstrings, pull in with the hamstrings. Dorsiflex, plantar flex, dorsiflex, plantar flex. All right, she's 5 of 5 in all of the extensors. The hamstrings, they curl the thigh, or flex the thigh, sorry. Plantar and plantar flexion and dorsiflexion of the foot. So she's 5 of 5 everywhere like that, all right? So now we're going to do some deep tendon reflexes, all right? Let's just do all 3 up top. I know that in the video they showed us 2. We got 3 up top, 3 down below the way I think you guys want this done. And so we'll just come in here, put it right on the tendon, thumb. Excellent, 2 plus. She got good reflexes. All right, relax your arm, relax your arm. Good. Come over here, right on the tendon. Boom. Come down here. That's the biceps brachioradialis triceps. Down here, relax your leg. Relax your leg. I'm going to lift it up for you. L4. All right.
That's funny.
Pretty good one. 2 plus. All right. Relax, relax, relax. I can just lift this up. Dorsiflex it. All right. L4, S1. I think you guys call this the patellar and the Achilles. All right. So those are 2 plus and equal bilaterally. No issues with those. Oh, also, I forgot the Babinski. Let's do this. Hold your foot out. Put it right over here on me. We're going to start right here. I'm going to rotate it this way, okay? All right, we have flexion. Anybody over about the age of 2 needs to be at flexion, and she went into it, and that's appropriate. If she were to fan out, that's a little bit of a problem. We don't want to see that. So let's do it again. Relax. Ooh, good one. Okay, so Babinski's all right on both sides. At this point, that's it. That's the neuro. At least that's what I remember to do. I hope this finds everybody well. I'm going to turn this off. We're going to turn it in.